My mission is to help people who are choosing conscious parenting or mindfulness paths, people who are more associated with natural lifestyle choices as they're raising their children, as they're going through their pregnancies, as they're making decisions about their birth, help find something that matches their values when it comes to healthcare. In this One Belly Wednesday, what we're going to be talking about is what happens during pregnancy when things don't necessarily go the way that you expect. One of the things that we're noticing in the perinatal, so pregnancy kind of group of chiropractors that I talk with all the time, and we're finding this is true with my nurse midwife friends, we're finding this is true with our labor and delivery nurses, is that we are having a ton, way more than usual, babies presenting in a breech position. So what breech means is that you have a baby who, instead of being head down in the pelvis, the baby has chosen to go head up. And I did a question out for my people the other day about, hey, what are your top two breech techniques? And by techniques, I don't necessarily mean something that we do as chiropractors to turn breech babies, but there are accessory techniques in addition to something we call the Webster technique that we really like to use in order to balance a pelvis. See, here's really what's going on. So if you have a baby who has a big old bobblehead, I want you to imagine that. So it's like a little mini bowling ball in there, right? That's the heaviest part of the baby, and it wants to be down. So if it's doing something that it doesn't ordinarily want to do, there's usually a reason why. So by the end of the second trimester, beginning of the third trimester, we're talking like 28 weeks or so, about a quarter of all babies are head up. That number gets cut down by the time we're around 34 to 36 weeks, gets cut down to about 7%. And so by the time babies are full term, usually in the obstetrics land, that's 2 to 3% of all babies are presenting breech. So you talk to an obstetrician about this in third trimester and they're like, not that big of a deal. But I'll tell you that around a quarter, that's 1 out of 4 of every mom that walks into my office usually comes in with a baby that's in a malposition. So either the baby's sideways or head up. And so there's a reason, and we look at the balance in the pelvic floor. My friends were suggesting a couple other really interesting tips. Things like the big muscle that lines the rib cage, we call the diaphragm. It's the one when you take a big breath in that drops down to allow the air to fill your lungs. They look at restrictions in there as possibly being too tight of a ceiling. I really spend a lot of time looking at pelvic floor tone. There's a lot of ways that I try to figure that out with my moms. Someone else made some suggestions about the psoas muscle. And the psoas muscles are the long muscles that go from the low back past the abdomen. They run down into the parts of the pelvis that are smooth. They come down in through fascial connections, like tissue connections, down the inside of the thigh and the knee. See, if a baby is in that position and those muscles are tight, they work like walls. So the baby can't quite maneuver himself or herself down or around in order to get ready to engage the head for the birth process. Now, I'm a breech baby. In 1978, there wasn't a whole lot that you could do in Greensburg, Indiana, to take care of a baby who, as my mom would say, looked on x-ray, because, yep, that's what they did in the 70s. They would x-ray her and see that here I was like a little frog, feet first, ready to hit the ground running. So I was a scheduled cesarean section. And that is usually what a lot of these moms, as they're trying to figure out what to do, are attempting to avoid. Now, babies can certainly be born breech. Like that isn't, there's no reason why they can't. You have higher risk involved with it, absolutely. We've had some hospital birth breeches. We've had some home birth breeches. It's not the intended thing down here, but there's some of my friends work with obstetricians who deliver breech, that it's becoming a lost art form. There are obstetricians who travel around trying to reteach people how to do that. So it's not like oh my goodness, this baby can't ever come out kind of situation, but there is more risk involved. So when we're looking at how do we make this the safest, most comfortable birth for our moms, to be able to allow her body to bloom and do what it needs to do, we're looking at communication things. We're looking at nerve communication into the pelvis for the mom. We're looking at bony pelvis alignment. We're also looking at that soft tissue. Now, if you're a partner and you're planning on a hospital birth, there's definitely things that you can do to help keep mom balanced, and not just balanced in her physical body, but in her emotional well-being as well. We put together a video actually for birth partners here locally. I'll put a link to that. If you're local to Southwest Florida, I want you to check it out, because that birth video has some tips from me, from a massage therapist, from a doula, from a hypnobirthing instructor, our best tips for being able to help out a mom who's in labor. If you aren't local to our area, by all means, check out the video too. It's a nice half-hour class that you can do, and it has local contact information. So when you see our contact details on there, hey, listen, feel free to give any of us a call. We have extensive networks all over the place, and if you find that what you're seeing is something that is more of what you want, we always have ways to connect you with providers in your area too. Those of you who are looking for chiropractors who can help out with this kind of stuff, the International Chiropractic Pediatric Association, ICPA, is the organization that I teach for. And the Webster technique, the technique that most chiropractors will use to address pregnancy and balance out a pelvis, is the first step for a lot of doctors where they really get introduced to the drooliness of birth, where they really get fired up about it. I've done my Webster certification 5 times now since 2008. I learned something every single time I go through that course, and it was really what fired me up about wanting to take care of pregnant moms. So if you have a friend who is saying, yeah, I just got the ultrasound and baby's head up in 32 weeks, let her know there's something that we can do. She doesn't have to wait. We have the best chances of success the earlier that we address this. Let me tell you a story. So earlier in this month, I had a mom, and we worked and worked and worked and worked with her body. It took a while to get her body balanced. And eventually the midwife, was like, yeah, I think we're looking good now. Did the ultrasound, baby was set down. We had a great big celebration. It took a lot longer than normal. And so I was talking to her midwife about whether or not she was seeing a lot of these breaches too. She had one of the most beautiful things to say to me. She said, Doc, when I see a mom who has a breech, there's usually some form of instability. There's some uncertainty going on in her life. And so her theory on it is that instead of coming out through the canal the way that nature intended, maybe what she's trying to do is come out the other way. And by the other way, I was thinking, well, like out through her mouth doesn't make much sense. She said, no, she's trying to come out through her heart, which I thought was just so beautiful, right? That babies are attempting to get closer to their mothers in times of uncertainty so that they can be one and stay that way. And I thought that was just a gorgeous way of looking at it. So, other people as they're looking are less poetic about it. They're thinking that maybe it has to do with a lot of sitting that it's happening since the great pause started. We aren't walking, we aren't getting out as much as we used to. And so maybe that has something to do with it. I'm not really sure. If you have ideas and you're a doctor, go ahead and put some comments in here. We share this video in a couple places. I hope you're following the Mama's Chiropractic page. This is how you're going to get the updates. We'll post this to our blogs. We'll do this to our into the groups that I belong to, all in order to share the information, and we want you to be able to share that too. So until next One Belly Wednesday.